Okay, guys, February is Heart Month, and this year it's going to be a Heart Month with a twist because the world is no longer same as it was. In 2020 left COVID impressions all over our future. And Heart Month will be slightly different now too. I'd like to spend a few seconds talking about the effects of this horrible disease, this pandemic that changed the world and what it does to the heart. Basically, this is an inflammatory process, and there's inflammation in the cells of the heart, usually resolved in damage or changes to the heart. Usually 5 mechanisms are noted. It can cause to progression of heart disease or blockages. It can cause problems with a muscle of the heart called a cardiomyopathy. It can cause rhythm abnormalities or an arrhythmia, and it can cause elevated pressures in the lungs, and that is called pulmonary hypertension. And of course, lastly, it can cause heart failure. And those are all the 5 mechanisms in which we see commonly damage, and this virus made things worse. People ask, how big is the problem? Well, it estimated to be up to 78% of people that have been admitted with this disease to have found changes in their heart. And it appears that up to 60% of them actually have long-standing effects. Even after being discharged and after they've recovered, there's still inflammatory markers that are seen. So how do we find out? How do we find out whether you're one of those 4 people that had the disease and have changes, or whether you're one of those people that have inflammation? Well, if you discuss it with your doctor, they can order some basic tests. Again, when appropriate, an EKG can show some of those changes. An echocardiogram, which is an ultrasound of the heart, can check the valves, the pressure, the structure of the heart, and check for inflammatory changes. There are some basic lab tests that, if they're appropriate, such as BNP and troponins, which have been shown to be elevated in people. And in rare cases, we may even need an MRI, which is, again, more accurate test to show. Not everybody's going to need this, but if you've had COVID, or if you are having any of these symptoms of shortness of breath, or chest pain, or fatigue, or simply not getting back to normal, and you're wondering if it's related, just let your doctor know, and we'll make a decision whether you need to have additional testing. Okay, guys, be safe out there.